And here, my dear friends, is one more video for you. Don't forget to subscribe to my channel and share with a friend. Caffeine good, coffee bad. Caffeine good, coffee bad. Caffeine good, coffee bad. For example, caffeine can come from guarana, which speeds up your metabolism, helps you get nice and skinny, makes you very awake. But let's talk about coffee. So it's the curing process of coffee that makes it highly poisonous. As a matter of fact, there is one step in the lengthy curing of coffee which involves cyanide. Look, I was a chemist before I was a doctor, and then eventually 27 years as a surgeon. The curing process, I come from one of the countries that was one of the leaders of the world in coffee production. I understand coffee, although the last time I had coffee was in 1974, the year I became Mormon. So, nothing to do with religion, coffee. So the process of curing the coffee seed, from the moment it comes from the tree to the moment you drink it. So let's start with the brutal, shall we? Osteoporosis. Coffee affects the lining of your GI tract, gastrointestinal tract, and it stops or slows down the absorption of calcium and vitamin D. What? Of calcium and vitamin D, which of course blocks the constant replacement, reconstruction of your bony tissue. You're going to have osteoporotic. So coffee increases the risk of osteoporosis, which affects women principally and men. Okay? But here's something that is far more disturbing to me. In a society today that's chronically stressed, and almost all the disease of society can be traced to stress. In a society that is running past maximal speed day and night, yet is extremely sad. It is shocking to me how sad society has become. I want to talk about not only the neurology, but the psychoneurology. When you consume coffee, it will block the absorption of the B complexes. Some example: B5, B6, B1, B12. My gosh, I can't believe it's being called vitamin. It should be called a hormone. The B complex should be called a hormone. You block the B complexes, it's going to affect your serotonin, and it's going to make you very sad, and anxious. So I see a literal explosion in psychiatric diseases, not the least of which is depression. So every patient I see in my office, I would see that 3 in 5 is taking something for depression. How is that possible? Many of the antidepressants have neurotropic changes. In other words, you're going to have Parkinsonism at the end of your life. Tremor. So, I'm depressed. I'm going to take medication. It's in a vacuum. Nothing in life is in a vacuum. You're going to have Parkinsonian tremors at the end of your life. Far better to prevent depression, anxiety. Remember, the more coffee you drink, the more sad you will be, and the more nervous you'll be. Okay? In contradistinction, the more coconut water you drink. Do an experiment, okay? Because I'm a very serious surgeon, but I have a very happy side, a silly side even. I want you to, in a day where you're sad, go to the beach and literally drink coconut water, pure coconut water. Not possible to be sad. Coconut water is so rich in the B complexes, the same one that the coffee blocks. Not possible to drink coconut water if you're a red-blooded human being, most human beings, and not be happy. Not possible, okay? So if you keep drinking a coffee, you're going to be a nervous wreck, you're going to be very sad, and your bones will be brittle. So, of course, it's part of our American culture. My God, it's certainly part of my Latin culture. Am I asking you to stop? No. I'm asking you to decrease the consumption of coffee. Until next time, because I'm concerned about your health and your happiness. Ciao, ciao.